Nosson, I don't know if you find this strange, but I literally just ordered a book called Therapeutic Improv, but I haven't read it yet. And now here we are. And I'm supposed to do some sort of improv, somehow therapeutic.
Well, how can you read a book on therapeutic improv and then do improv? How would that work?
I haven't read it yet, so I don't know.
Is your therapy?
I like that question.
Do you find some of your therapy to be improvisational?
I find most of my therapy to be improv.
Yeah.
Yeah. I find that the books that I read, the trainings that I've done, is just to sort of develop some sort of fundamental idea that I can get into my kishkas about therapy. And then I just have to come into the room and be me, for better and for worse. And I won't tell you how often it's which one. How about you? What are your thoughts about that?
Well, I'm psychoanalytically trained. As psychoanalytic theory has evolved, there's much more emphasis on improvisational input by the therapist, talking about what I'm feeling right now. And I find often just an intuitive idea that occurs to me in the middle of everything can be extremely valuable.
So do you call that improv, or you see that as something different?
I could call it improv.
There you go. So I'll let you know when I read the book what happens.
Yeah, I hope it's a good book.
I hope so too. I buy a lot of books. Are you into books still?
Yeah, definitely.
You're still buying books?
I've been reading for over 30 years.
Is there a 12-step...
More than that.
Is there a 12-step recovery program for mental health professionals and book buying? There should be.
I hope not. Why?
It's a little out of control for me.
You think so?
No, I know so.
Oh.
Yeah. I have to buy
I
books.
read very slowly.
Me too. I'm in the middle of several hundred books.
I'm in the middle of 3 right now. Actually, I'm reviewing all 3 of them.
You're in the middle of only 3 books?
Only 3 books right now.
And what about if you put Suffern into the mix?
So then I'm in the middle of 5 more Suffern.
5 Suffern and 3 books?
Yeah.
I don't know how to do that. How do you do that? Teach me how to do that.
Well, that would be a long-term course, I think. You have to have an organizational personality. You have to be kind of obsessive compulsive.
Okay.
So that you can cut things off at a certain point.
Meaning cut things off, say no to that book because I'm still doing this one.
That's right.
Okay, I already failed. I can't do that. I don't know if a long-term course can help me with that.
How is that reflected in the therapy that you do?
I think that I naturally come up with metaphors in the moment, or imageries in the moment, or different ways of languaging something in the moment. And I think part of why I feel like I can do that is because I read so many different things. So I get so many different ideas and different angles and stuff. And I like that. I appreciate that.
Well, let me ask a different question. You and I do very different types of therapy.
Maybe. I've never been in the room with you. Have you? I can't comment. Have you been in the room with me?
You've been in the room with me, but what do you think? What would you say are some of the universal factors, healing criteria in treatments of all kind?
In terms of successful outcomes for treatment?
Yeah.
I mean, without even thinking about it, the relationship is what comes first. That's, we all know that. The client feeling like the therapist really has a sense that they can be helpful, but not from a place of ego or a place of, not being related, just being in their own head. But, I think that's important. There's a sense of safety and trust that can develop much quicker, much more effectively when that's there. And the person has to feel heard. The person who's in therapy has to feel really heard and seen. And that's something that I don't know if I'm ever going to be able to stop working on that for myself as a human being. How to really help, where to put myself and where not to put myself in the room. So the other person can really be seen and heard, but not in the way that maybe sometimes people can practice, or people with less experience where, and then it's all about the client speaking, but really out of a place of the therapist not necessarily knowing or where and how to put themselves, not from that place, but really from the place of cultivating the space of having you, the other, experience being seen and heard.
Mm-hmm.
What are your thoughts about that?
I think that's the most important thing
Yeah.
The ability of the therapist to really listen and the patient to feel that he's been heard. I think that's the most curative part of all therapies.
Yeah.
And I think there are not very many therapists who know how to do that, quite frankly.
Do you think that's an idea that's fundamentally psychoanalytic or psychodynamic? Or
No, I don't. I think it's an idea that's fundamentally healing.
Mm-hmm.
I think healers of all types know that. But I think that in our profession, there are too many people who don't focus on that. And they can be technical, or they can be pushy.
Do you think that's a sign of the times, like how things have sort of developed and evolved, or you have a different perspective about that?
Well, I think that's very possible. I think patients now, even though they have an internal sense that they want to be heard, and I think that's internally, that's what they come for. But their idea is, this better be quick.
Mm.
I want it fixed, and I want it fixed now.
The age of Dr. Google.
Yep. I think.
And then
so.
we are sort of, as a field, reacting and responding to that.
Absolutely.
And getting sucked into that.
Absolutely.
And participating and enabling it in a way.
Don't you find that there's like a new fix every week?
Oh, yeah. But I think it's a sign of our own age, chronologically and professionally, is, everything new, we say this isn't new. This has been around. So that's the new way you've packaged that,
Yeah, that's what we say.
The new buzzword.
That's what we say. And I believe it. I think it's true. There's a lot of repackaging.
Maybe the name of this little conversation will be Two Old Men. I like that. That might work.
Yeah, well, I guess, we've seen a lot. When I went to graduate school, there were only two types of therapy. There was behavioral therapy. That's what it was called.
Right.
And psychoanalysis. That was it.
Right. Yeah. And I went to a school, interesting, where there was a clear orientation, but there was also an emphasis on having professors who taught outside of that orientation. And that was enriching. I appreciated that as well.
Mm-hmm.
I wasn't being forced to learn only one thing, one perspective. And funnily enough, the perspective that I sort of took to initially wasn't the school's orientation. So it was those, elective courses that I really fell in love with, that gave me the passion in graduate school. Yeah. So people are not mastering, you think, a specific orientation and then just allowing that to internalize. They're just busy gathering tools. And
I think that's a very, very important point that you're bringing up. To me, what a therapist needs to do is to be kinder for himself, to acquire a way of looking at life and mental health. And then you work from that. But if all you're doing is going to a bunch of training exercises, and you and I have both seen these questions. What do I do about this patient? What do I do about that patient? You haven't acquired a view of how to attack problems in living. That's a problem. I
do want to offer both of us a congratulatory or acknowledgement, because before we walked in here, I wondered to myself, how many minutes would it take before we got to this point? And it took us 9 minutes. I thought it would happen much quicker.
Did you?
Yeah.
Is that good or bad?
I knew we're getting here somewhere. Somehow we're going to get to this, this gripe.
Actually,
that's happening.
Actually, if you had not begun, I would have started out there.
You would have started there?
Yes.
Was that where you wanted to go? Let's start over. Hi, Nosson.
I think that's certainly on my mind. I think it's on a lot of people's minds today. That it's just such a proliferation of.
I wonder. I haven't asked enough. I'm just busy with the private practice. I'm not doing agency work like I used to. But I wonder for people that are newer in the field if they themselves see this and struggle with this and wish it was different, or they're just sort of swept along with it and buy it. And I don't know. I like to believe that a lot of people sort of sense that they're not getting something that they should and need. I hope I'm right. I don't know.
Well, I that's a very good question. Personally, when I refer out, I'm not necessarily looking for a psychoanalytic therapist. I'm looking for a therapist who has a mahalach, not one who's kind of vulgaring around, Mm-hmm. That to me, that's the most important thing. If you have a way of thinking that you can believe in, you can help people.
Yeah. Yeah. And the truth is, though, that even that, even that has sort of evolved for me. You know, I think at different points in my career, I would have described my mahalach differently. But then how I am today with that and what I describe now feels it's not going to evolve in a significantly different way. There won't be a drastically different way that I'll describe how I understand therapy and how I orient myself in the room. Hopefully, I'll continue to grow and evolve as a human being and a professional, but it's hard for me to believe it's going to have any radical shifts. You know, I think we've hit that stage.
I think that's probably true.